Welcome, IGNOU aspirants. Today, we are diving deep into Unit 9, Determinants of Health Services. This is a really important topic, so we're going to break it all down with a sharp focus on exactly what you need to crush it in your exams. So let's start with this question, because it gets right to the heart of everything we're talking about today. It sounds simple, right? But the answer is super complex. In this explainer, we're going to explore why the normal rules of economics just kind of fall apart when you apply them to healthcare, and you absolutely need to get your head around this concept.
Okay, so to really get healthcare, you first have to understand two key ideas: structural determinants and proximal determinants. Think of it like this. The structural factors are the big picture stuff, the whole country's economic system, its politics, its policies. Then you've got the proximal factors, which are all about your day-to-day reality. Your home, the food you can get, your immediate community. It's basically the entire system versus your personal world.
Here's our game plan for this explainer. We've structured this to hit all the key points you'll likely see in your exam questions. We'll start with the weird economics of it all, look at demand and supply, touch on technology, and then wrap it all up with a super focused revision session.
All right, let's jump into our first section. We're going to tackle why the demand for healthcare is just so different. It's not like buying anything else, and understanding why is absolutely crucial.
Now, here is a fantastic piece of jargon you should definitely write down: fuzzy demand. This is perfect for a short answer question. You see, with a phone, the relationship between price and demand is pretty clear, but in healthcare, it's a gray band. That means for the same price, you and I might get totally different amounts of care. Or for the exact same surgery, we could be charged wildly different amounts. It's fuzzy.
So why is the demand for healthcare so steep, or what economists call price inelastic? You need to remember these four big reasons. 1, it's a necessity, not a luxury. 2, things that aren't about price, like trusting your doctor, are hugely important. 3, insurance hides the real cost from us so we don't feel the price as much. And 4, and this is a big one, there's something called supplier-induced demand, where your doctor might suggest more tests or treatments than are truly needed.
Now here's a really critical point. Yes, income matters, but the relationship between wealth and health isn't a one-way street. It's not just that richer people can afford better healthcare. It also works the other way. Being healthier actually helps you become wealthier. It's a two-way street.
And this chart illustrates that big picture link perfectly. You can just see it so clearly. Countries with higher incomes tend to have populations that live longer. This isn't just a random correlation, it's a fundamental relationship. Better health is a form of human capital that fuels economic growth for the whole country.
But let's bring this right home to India. Look at these numbers: 83.7% versus 12.7%. What are we looking at? Well, according to the National Family Health Survey, a massive 83.7% of women from the wealthiest households gave birth in a medical facility. For the poorest households, that number jumps to a shocking 12.7%. This one statistic tells you almost everything you need to know about the income gap in accessing even the most basic healthcare.
Okay, now we're going to dig even deeper. We're going to look at what the source material calls the causes of the causes. These are the powerful social factors that shape our health, and they go way beyond just what's in your wallet.
This is another one of those definitions you absolutely have to know for the exam: the social gradient of health. It's the idea that your health is directly linked to your position on the social ladder. The higher your social and economic status, the better your health tends to be. It creates this step-by-step pattern or gradient all the way down the ladder.
So what creates this gradient? Well, the source highlights 3 huge socioeconomic factors. These are really the pillars that determine where a person stands on that social ladder we just talked about.
And to make this super easy to remember for your exam, here's a simple mnemonic: EEO. It stands for ethnicity, education, and occupation. When you get a question about social determinants, just think EEO, and you'll have a great structure for your answer.
Now, if you want some powerful proof for that first E, for ethnicity, just look at this table. In a developed country like Australia, Indigenous men have a life expectancy that's a staggering 17 years shorter than the national average. 17 years! And we see these kinds of disparities in India, too, where data from the NFHS3 shows that infant mortality rates are much, much higher for scheduled tribes compared to other groups.
All right, let's switch gears. We've talked a ton about what drives demand for healthcare. Now we need to look at the other side of the coin: supply. What are the forces that control how much healthcare is available and what it costs?
Here's another one of those key terms for your exam:
evergreening of patents. It sounds kind of nice, but it's a tactic where drug companies make tiny, often meaningless changes to an existing drug right before its patent expires. This lets them file for a new patent, extending their monopoly for years and keeping the price artificially high while blocking cheaper generic versions.
So what can governments do to fight back against these high prices? Well, they have a whole toolkit of price controls. For your exam, try to remember these 5 main types. They range from things like reference pricing, where they peg the price to similar drugs, all the way to directly regulating how much profit a company can make.
And this is a really crucial distinction you need to understand, the difference between a product patent and a process patent. A product patent is the really strict one. It protects the final drug itself, completely blocking anyone else from making it. A process patent is less strict. It only protects one specific method of making the drug. That leaves the door open for other companies to find a different recipe. This has a huge impact on supply and cost.
We all know technology in medicine is a game changer. But its effect on costs isn't always what you'd think. It can be a huge money saver, but it can also be the main reason why healthcare expenses are skyrocketing. It's a real double-edged sword. Let's look at why.
So here's the deal. Not all tech is created equal when it comes to cost. You've got high technology like vaccines. These actually save money in the long run because they prevent expensive diseases. But then you have halfway technology, think organ transplants or chemo. They are amazing, but they manage diseases without curing them, and they are a major reason costs are going up. And finally, there's no technology, which is all about care and comfort, like good pain management.
All right, we've reached the finish line. Let's pull everything together into a quick-fire revision guide. This is the stuff you really want to lock in for your exam, so pay close attention.
Okay, for the demand side of things, here are your key takeaways. 1. Remember that income and health is a two-way street. 2. Know what the social gradient is. 3. Remember our mnemonic EEO. And for bonus points in your answers, you'll definitely want to mention that powerful data from India's NFHS3. It makes your argument so much stronger.
And now for the supply side and the key jargon. On pricing, remember the role of patents in that trick evergreening and how governments fight back with price controls. With technology, remember that halfway technology is the big cost driver. For the Indian context, know about performance-based finance, or PBF, for ASHA workers. And finally, make sure you can write a solid short note on fuzzy demand and the social gradient of health.
And that wraps up our explainer for Unit 9. To leave you with something to think about, consider this. If we know that health is so deeply tied to creating a fairer society, what's the most powerful thing a government could do to improve health that has nothing to do with hospitals or medicine? Just think on that. Good luck with your exams.